Welcome back to 10-Minute IO, where you'll find bite-sized information on all topics related to industrial organizational psychology. My name is Steve, and I'm an IO psychologist. Today we'll be talking about test validity. Before we get started, though, last recording somebody mentioned that sounded a little monotone, a little flat. So I just want to explain why that is. Two reasons. One is because I usually record these around 1 o'clock, 2 o'clock in the morning, so I'm pretty tired. The other reason is, as you know, talking to a computer is pretty difficult. So she recommended I talk into or have a picture in front of me so I can pretend I'm talking to that person. Anyway, I found a picture of my grandmother, so her picture is right in front of me. Even though she didn't speak English at the time she was alive, we'll see how it goes. Let's get started. If you watched the last video, we talked about, I made a distinction between reliability and validity and mentioned that those two are not the same concepts. Reliability has to do with consistency, whether that's consistency of score over time or consistency among the items that are designed to capture that same concept. Validity, on the other hand, has to do with truthfulness, or the question, does your test actually measure what it's designed to measure? So if you're trying to measure sociability, are you actually capturing accurately that concept of sociability? And there are several ways to do this, and we'll talk about each one of those here. So what are the different ways to gauge validity? Here I show three different approaches to gauging validity: content, construct, and criterion-related. I'll talk about each of these in detail in the subsequent slides, but for now, content has to do with whether or not your test items are adequately covering the test domain, the space. Construct-related validity has to do with the concept itself. Are you actually capturing that concept, that psychological concept that you're trying to capture? And the third, criterion-related validity, we're interested in predicting behavior. Does your assessment actually predict the behavior of interest? So let's start with content-related validity. The goal here is to ensure that you comprehensively cover or capture the test domain of interest. To give you an example using a knowledge-based test, let's say Mrs. Smith is an English teacher and she presents 100 vocabulary words throughout the year for her 5th grade class. For her final exam, she wants to create a 20-item test. So in this case, you'll want to make sure that you capture a representative sample of the items that she taught. So here we want to make sure that she has some easy vocabulary words, some moderately difficult vocabulary words, as well as very difficult words. So in this case, visually, you can see that the items presented in the test are representative of the population of the 100 vocabulary words. So here's an example of a deficient test in the sense that the test itself, the bubble on the right, does not represent all of the words that were taught in class. So if you can imagine that the blue dots represent the actual words and the easier words are to the left, you can see that where the red bubble is, that some of the more difficult words are not represented in this particular test. And in this case, therefore, the test is deficient. Unlike deficiency, here I have an example of what's called contamination. If you take a look at the white dots on the right-hand side there, these represent items that were not taught in Mrs. Smith's class. So these represent items that the students would not be expected to know. And when you have extra items that really don't belong in the test, then you have something called contamination, and it would reduce the validity of the test. In the case of construct-related validity, here we're interested in producing evidence to show that we've captured the concept of interest with our assessment. And we can do that by administering our assessment along with several others, some that are similar and others that are dissimilar. Let me give you an example. Let's say Sally here is extremely shy and we have an assessment. We designed an assessment called introversion test. So Sally would score very high on this assessment. So along with this assessment, we would administer three others. One that is also a shyness test that has established validity, and the other two, sociability and social self-efficacy tests that are opposite of shyness. Let me go through the legend real quick. The green arrow represents positive correlation, indicating convergent validity evidence. Red arrow is negative correlation and indicates discriminant validity evidence. So we can expect that if Sally were to take all four of these assessments, her score on the introversion test would correlate positively with shyness test, negatively with the sociability test, negatively again with the shyness test and the self-efficacy, social self-efficacy test, positively with sociability and self-efficacy because they both measure comfort in social settings, and Sally would score low on both of those assessments. And then negative correlations between introversion, self-efficacy, and shyness and sociability test. If you can show these types of relationships, you would have established construct-related validity. Now, with criterion-related validity, we're interested in whether the assessment that we have created actually predicts behavior. We do that in one of two ways, concurrent or predictive, or both. Concurrent just means that we administer the assessment today and analyze the results today to see if the test scores correlate with actual performance or behavior. I'll show you an example in a minute. Predictive just means that we would administer the assessment today, and then we would follow the group of people that we administered the assessment to, employees, let's say, and then maybe a year later we would look at their job performance and see if they correspond to the scores that they obtained on the assessment. So let's imagine that we created this assessment called Sell You Anything. It's a sales competency test. It's designed to predict sales performance. And let's also say that we have a fictitious organization, a sales organization, with 100 sales employees. Now what we would do is, today is Thursday in June, we would administer this assessment, Sell You Anything assessment, to all 100 employees. And of course, we would expect that if the test is good at distinguishing or differentiating different people in terms of their job performance, we would expect that superstar employees would score very high on this Sell You Anything assessment, whereas the average or poor sales employees would score lower. In a sense, indirectly showing that this assessment actually can distinguish high performers from average and poor performers. That, in a nutshell, is concurrent related validity. Now, with predictive validity, we are still interested in predicting behavior, but unlike concurrent validity, which is interested in correlating the test score with job performance today, we are interested in administering the assessment today and seeing what happens down the road, whether the assessment scores correspond to actual behavior in the form of job performance down the road, whether that's 6 months or 12 months later. Going back to the same example with the Sell You Anything assessment, what we would do is for incoming candidates for a position in the sales organization, we would administer the assessment to all the candidates. And with those candidates, we would have scores hopefully distributed across a wide range. Assuming that, let's assume all those candidates were hired. A year later, we would look at their performance evaluation to see if the test scores correspond to their performance evaluations sometime down the road, 6 months or a year later. Now, wait, Grandma has a question here. She says, well, so are you using the test scores, the Sell You Anything test scores, to make hiring determinations? And that's a great question. The answer is no, because the Sell You Anything assessment has not yet been validated. We cannot use that to make hiring decisions. The company would simply hire as they have been using their methods, and then once the assessment has been validated a year later, meaning that the candidates who scored high on this Sell You Anything actually did perform higher a year later, then we would be able to use the assessment because we would have established predictive validity at that point. So far we talked about 3 types of validity: content, construct, and criterion-related validity. So what are the rules of thumb for gauging validity? Starting with content, there's really no correlation coefficient associated with it, because as long as you use subject matter experts and ensure that you cover comprehensively the test domain, then you're okay. With construct-related and criterion-related validity, we do have correlation coefficients that we do need to examine. Now, I'm not going to go through each one of those as they're self-explanatory. I just want to mention that there are really no fixed guidelines, so some of you out there might disagree with these numbers, but these are approximations based on my understanding of the literature and my personal experience in designing assessments. So keep in mind that these are approximations. So that's about it for test validity. I know it's a lot of information to cram into a 10-minute video, so I want to thank you for watching. Coming up next, we have, does your favorite personality test pass the horoscope test? This is a fascinating topic, so I hope you'll join me next time.